AC is going to be out here. This thing will be like popped up, and you can visually see the difference. If we had some people, I've had people have this before. Observation, good side, bad side. Okay, palpation, sensation, same idea. Does this feel the same? And the thing is, when they do this stuff, you kind of want them watching you, not watching what you're touching, because otherwise they can't pick up on it. And then squeeze my fingers, those kind of things. So sensations, does this feel the same? Hot, cold, those things go along with that. At this point, we can go ahead and check for fractures. Fractures are easy. Clavicle here, sternum in the middle. Clavicle, you just tap on the thing, right? And plus, if you've ever seen a broken clavicle, there'll be a big bump. So therefore, if you see a big bump, you really don't have to hit it. That's kind of a personal thing. I'm probably going to give it a slam, but you know, it's going to be up to you. Okay, then you have, don't forget you got the scapula back here. The scapular ridge is going to be here, so I'm going to go ahead and tap on that thing. And that will cause pain, because our job is to, good. Happy humerus, bam. That right there, and this will work there, okay? Fractures, got it? Okay, at that point, we're going to go ahead, good idea. Range of motion, this way as far as we can, and you compare good side to bad side, look at her back, come back up the other side, and same idea. Jeez, this one. Okay, biceps. Okay, now we're going to head and do the test. Now remember that I said that the first two tests are, they're related to the shoulder, but they're not really related to the shoulder. They're like fake tests. So put your arms up like this, push up, biceps, push down, triceps, push in, subscapularis, right? Push out, infraspinatus teres minor. This is also teres major. Got it? Go with me? Remember your hands, and you can use your hands on these things because supraspinatus, infraspinatus, teres minor, teres major, subscapularis. You can use that. I like that. Up like this, turn your hands in like this. This is supraspinatus. It's 30 degrees out, internally rotating, keep your hands up. Boom. That's the supraspinatus. Okay? Everybody got those? Yes? Empty can. Okay, then we go to deltoids. Good side, then bad side. So we'll just do good side. Make a fist, push forward, anterior deltoid, push back, posterior deltoid, push out this way, mid-substance deltoid. With me? Everybody? Up like this, push down. What's this? Lats, latissimus dorsi, push up. Trapezoid, I don't know muscle. Push this way, push forward. Pecs, push back. Rhomboids. Everybody with me? Okay. Then we can look, and you would have picked up these things beforehand. SC joint's going to be here, AC joint here, and you can like push to see if it does move. And AC joint is called piano key sign. You push out here, and it'll go up and down. Jesus. Normal. Glenoid humeral. Remember, we have good sulcus signs here. There are some people with great sulcus. That's when you relax here. Yours didn't go anywhere, did it? And then we pull down here. But the sulca, what it does is the whole thing comes out. And I know it has people that have great sulcus. So AC, GH is glenoid humeral. Labrum is all that you're going to do with this is you have, just like in the cartilage in the knee, you have the labrum is the same thing as a cartilage. So ball and socket. So I put my hand here like this, and I'm just going to go ahead to see if she's got any kind of popping. She's got a band in here, man. She's got the whole percussion side. Is the other one like this too? Sorry. Rotator cuff impingement. What you do here, arm out, hand down, and your hands are going to go like this. And see your elbow's going to go down. We'll fake it. Because what happens is, this is what will cause pain with her, because when that pushes up, that will, the supraspinatus tendon is right on top of that, and when that does, that pushes up on top of the supraspinatus tendon. That's why that hurts. You got that? So when you have that thing going on, what you're going to do as clinicians is you're going to make sure that the rotator cuff becomes strong. And when the rotator cuff becomes strong, and then that should get it some area in there unless you have all kinds of complications like you do. Bicep tendonitis. You got to know where your bicep tendon is. Just come across here like that, and you can feel bicep tendon. It's a core thing. Go. Yeah. The other thing you're going to notice is that if they have impingement, the next thing that will be sore would be the bicep tendon, because the bicep tendon is the last thing around to hold on tight. So you're like perfect for all this bad stuff. Thoracic outlet. This is a great one for you because people miss this thing. You get a radial pulse, and as you bring her head this way, what it'll do, it'll shut off the pulse. And the precursor of that is they will talk about, most of it happens with swimmers, like I said before, and they'll talk about their arm turns blue when they run. They've lost circulation. That's thoracic outlet. Drop arm. You guys got to pick the, I've had people come to class that didn't know what this was. All we do is we bring our arms up like this, and they get right to here, and the supraspinatus will not hold on, and their arms will drop down. what they'll have a tendency to do, they'll come this way and they'll try to hold it up at the deltoid. But you want to try it so that it just works their supraspinatus. Okay? Easy? Wing scapula, all that you do this one is you just go up against the wall. Is just lean against the wall like you're doing a push-up, a wall push-up. And what'll happen, didn't somebody have this?
Yeah.
Yeah. And this whole scapula will like come out. And that's essentially it. Okay? Any questions? Do it. Go.